Hi, I'm Dr. David DiLoreto. I'm a professor and chair of the Flaum Eye Institute. Age-Related Macular Degeneration, or AMD as we call it in the clinic, is a disease that affects the retina, which is the nerve tissue that lines the back wall of the eye. It slowly degenerates over age due to various factors. AMD is very common. In fact, 13% of people over the age of 40 have AMD, and we think about 2 million people in the U.S. are affected by AMD over the age of 65, and that's when it tends to become the most serious. It affects a lot of people. In fact, mostly older individuals, like I said, over the age of 65 to 70, mostly affects Caucasians or people with lighter skin, much more than people with darker skin. It affects females a little bit more than males, and then other risk factors for AMD include cardiovascular risk factors like smoking and obesity. Then, of course, there's many genetic factors that we haven't quite solved yet. Over time, as the retina ages, drusen develop, which are little deposits of cellular debris and lipid that form under the retina, which causes the nerve cells slowly to degenerate over time, often leaving patients with distortion of their vision. We call metamorphopsia, where straight lines look crooked, or scotomas, which are blind spots in the center of the vision. AMD is diagnosed on a clinical exam, so we recommend patients over the age of 50 come in for a dilated eye exam. If there's a history of age-related macular degeneration in your family especially. AMD is treated depending on the form, so wet age-related macular degeneration, or wet AMD, is usually treated with a series of injections of medicine into the eye to stop the growth of blood vessels and the leakage that occurs under the retina that causes visual loss. And those are usually done anywhere on a monthly to every 3 monthly basis to start, depending on the medicine. Dry macular degeneration, up to about a year ago, there was no treatment for it. But now the very severe form of dry AMD, called geographic atrophy, there's new treatments coming onto the market, and there's 2 out to date that we've recently started here treating patients at the Flaum Eye Institute. Life can be extremely variable based on the patient and the way they deal with it. Their visual loss. I've had patients who've lost their central vision in both eyes and are able to function fairly well, while others may be quite confined to their apartment or familiar places. It makes it very difficult to get around. But all in all, I would say, reading vision is affected, your sharp vision, your color vision. Those are pretty much, once you lose the center of your vision from either wet or dry AMD, those are things that people struggle with the most.